Good morning, all. Welcome to a new session of COVID-19 Academy. As you are already aware of, COVID-19 Academy is a capacity building initiative of NDMA, UNICEF, WHO, HCL Foundation, and Sphere India for volunteers and outreach workers from across India for COVID-19 preparedness and response. And our today's session is about infection prevention and control during COVID-19. The course will help provide necessary information regarding do's and don'ts to be followed besides hygiene practices during and after the current COVID outbreak in households, communities, public spaces, and for schools, which might get converted into temporary shelters and quarantine centers. We have our eminent speakers for the session today, Dr. Pratibha Singh and Dr. Apurva Chaturvedi from UNICEF. Dr. Pratibha Singh is a water, sanitation, and hygiene in institutions specialist working with UNICEF New Delhi. She has worked with what can wash in normal circumstances during emergencies and also on environmental conservation since past 16 years, out of which 10 years have been in UNICEF. She is supporting the COVID-19 response on WASH of UNICEF India. Dr. Apurva Chaturvedi is a health specialist at UNICEF India country office. She's an obstetrician and a gynecologist come Erasmus Mundus European Commission scholar in international health, contributing to RMN-CH+A and health system strengthening measures, particularly for maternal and newborn care over 14 years. She has been working closely with the government, UN agencies, academia, and civil society organizations across all levels of healthcare and was associated with Asia Europe Foundation on pandemic preparedness, response, and scenario development for Asian region. Dr. Apurva has also briefly served in Africa during the post-Ebola period for supporting MNCH services, and currently she is supporting the COVID-19 response on maternal, newborn, and EMTCT and adolescent health services, including IPC and WASH for UNICEF. Welcome again, our eminent speakers, and over to you. Thank you.
Good morning, everyone. This is Dr. Apurva here, and I hope everyone is keeping safe and healthy. And can I share my screen now, Praveen?
Yes, ma'am, we can see you. Yeah, you're audible as well.
Okay, so let me just share my screen. Can you confirm if you can see the presentation slides?
Not yet, ma'am.
For me, it shows that it is there.
Yes, ma'am, we can see your presentation right now. Pretty clear. Yeah.
Okay, so shall I start now?
Yes, please.
Okay, so good morning, friends. And it's my pleasure and a big opportunity to interact with you and take you through this very important session on infection prevention and control during COVID-19 in India. And friends, we all know that these are challenging times for all of us, and we have never seen anything like this, at least in our lifetimes before. So these are unprecedented situations which require unprecedented measures. And you all know that coronavirus called SARS-CoV-2 virus is responsible for causing the COVID-19 infection. And to date, more than 118 countries have been affected with COVID-19 infection, which itself tells us how fast this virus is spreading within a short span of less than 3 months. And I'm sure you all know that it can easily transmit to human transmission. There's an enough evidence, although the main source of spread is the respiratory droplets, which when a person coughs or sneezes or exhales, gets transmitted from one person to another. Also, when you're touching any contaminated surfaces or objects, and if these are infected with the virus, then you have chances of getting infected because you tend to touch your face, skin, mouth, eyes. Those become very potential source. And healthcare workers in our hospitals are particularly at a very high risk because they deal with patients. They are in a zone where they are at high susceptibility of getting in contact with a person who is having COVID infection. So this current presentation is about infection prevention and control during COVID-19, and I'll be taking this session along with my colleague, Dr. Pratibha, who's a WASH specialist. So what we are going to take you through this presentation, we'll try to keep it very simple, and we'll tell you what are the basics of infection prevention and control, why it is important, what are the critical components. So I'll be covering the health facility part of it, and followed by infection prevention in household and communities. And also, as you can see now, with the increase in number of cases, government has taken up many other facilities which are beyond hospitals, like sports complexes or schools or community buildings as quarantine centers. So we'll be talking about quarantine centers and how you can have infection prevention measures implemented in these quarantine centers. And also, if a person is home quarantined, what are the important measures to be taken? So the home and community part along with environmental cleaning part will be covered by Dr. Pratibha. So friends, basically IPC, infection prevention and control, it's a scientific approach. So there's a good science behind it, and the science is very simple. If you break the chain of transmission by following the prevention methods, you can break the spread of infection. And these are very practical solutions which have been designed to prevent harm. It is not only preventing harm for the healthcare professionals and workers who are exposed to risk, but also the patients and even the caregivers at the families or who are accompanying a patient. And these are very simple solutions which, if can be implemented, can break the chain of transmission, and we can prevent this infection from moving forward. And infection prevention and control measures also ensure that your healthcare centers do not become the site of infection. Rather, they remain as the centers for providing care and relief. And you must have been watching news. Everyone is following news every day about the number of doctors, nurses across Italy, across the globe getting infected with COVID-19 infection. So that clearly tells us that the healthcare staff is at risk and at a higher risk. And the IPC measures are therefore rooted in patient safety and health service quality. So it is not only the safety of the healthcare provider, but also the safety of the patients in the hospital, so that a person who is not infected does not get infected with the COVID infection. Now, who is at risk? If I tend to think myself as a person who is infected with a coronavirus, I can transmit it to any person in the health facility if I'm approaching a health facility for treatment. It can be the doctor who is checking me, it can be the nurse who is taking care of me, it can be other patients in the wards if I am in contact with them in the OPD, in the IPD waiting areas, if I am not following IPC measures. Or it can even be the cleaning staff who is exposed to the infectious material who are doing throughout the cleanings. And when you see this slide, when the hospital staff goes back to the community or to the home, they can infect or cross transmit their family members or people in their community or other patients who are in the wards. So, literally, everyone is at risk of infection. That is why it is said that you have to protect yourself, not because you are suffering from COVID infection, but every person is at risk. So the more we minimize the risk, the better chances of reducing this infection. So it is not just that few set of people are at risk. Now, what are the benefits of infection prevention and control measures? There are huge benefits. First, you are, as a healthcare provider, you're not only protecting yourself, but as a healthcare provider, you're also able to protect your patients. And I understand the session here, we don't have healthcare providers at audience, but the people who have joined the session, it is very important for them also to understand that why these measures are important at the health facility and why so much effort is being put up by the government and everyone to have the IPC measures in the health facility. Because we don't want that the germs should enter the health facility. We have to limit the infection to reach the health facility, and that is where, as a patient, as a caregiver, my role also comes, that I don't become a person who's spreading the infection, or I am not an attendant who is contributing to spread just by my ignorance. And also, it is about protecting your family, your community, and environment for getting this infection spread. And what does IPC measures do actually? Why they are so important? Because they act as a barrier. They act as a wall for spread of infection. And as I already mentioned, COVID-19 is primarily transmitted through droplet and contact routes. So if we are able to break that contact, if we are able to break that chain of transmission, then we are able to protect our communities, our families, our patients. And next slide, I'll show you a small diagram and it will tell us how the routes can be. So there are these two people, and if one person is affected from corona infection, and if the person sneezes or coughs, there's a chance that there can be a direct transmission through your cough and sneeze through respiratory droplets. So here comes the importance of social distancing and maintaining a distance of 1 to 2 meters. And the person who is affected following the respiratory etiquettes when you're coughing or sneezing for anyone, and also following hand hygiene measures. So social distancing becomes important to break that barrier and keep it as a barrier to maintain the adequate distance. Also, if a person is infected and if he is touching surfaces and objects which are clean surfaces, then the person can transmit infection to another person if other person comes in contact with the same contaminated surface and he is touching his face without washing hands, and then the eyes come in contact or your face comes in contact. So that is why it becomes very important to follow hand hygiene measures and other protective measures. And also your hands. The hands are the biggest tool that everyone uses for any kind of work. As a human being, our first tool is our hand. For any activity we do, we use our hands. So they are the biggest source of infection. If you are not following proper hand hygiene practices, you can infect not only yourself, but you can transmit infection and you can catch infection. So hand hygiene is one of the most important infection prevention measure. Now, if you see the WHO recommendation and guidelines, there are basically 5 strategies which are extremely critical and to be followed across the globe, across all health facilities and settings, which will help us in preventing the spread of infection. And I'm concentrating here at the facility level. When I'm saying facility, my talk is restricted to health facilities. So early recognition and isolation of patients with suspected infection. This is very important. There are so many patients who and so many cares people who come to hospitals for seeking care. We don't know who is symptomatic, who is carrying the infection. It is extremely critical that there is a triage facility and any person with symptoms is screened, and if having symptoms of COVID infection is immediately isolated so that the infection doesn't gets transmitted to other patients or the doctors and staff providing. Second strategy is applying standard precautions. And there are a set of standard precautions which are very simple to follow and very effective, like hand hygiene measures, respiratory hygiene, and injection safety measures. And also the when a doctor or a staff or a medical provider is providing healthcare in a facility, he is touching his stethoscope, he is using the BP instrument, he is using various equipments. And these equipments, if not properly disinfected and cleaned, can become a potential source of infection or cross infection. So these measures are important, and also the waste which gets generated in the health facility, which my co-facilitator will be talking about. Then there are certain additional precautions which are to be followed for preventing the droplet infection and infection which you can catch in terms of contact, which family members and contacts have to follow. And these are also standard precautions. Then there are some airborne precautions for suspected cases, but these are only for health service providers, and we will not be going through detail because they do not fit within the purview of this presentation, but we'll just tell you about it. And then in any healthcare facility or any quarantine facility, there are certain basic administrative controls to be followed, like the infrastructure, what kind of infrastructure should be there, what should be the distance to be followed, what kind of capacity surveillance monitoring. We will not go through detail about these measures, but we'll tell you that these are certain administrative control areas which are recommended for infection control strategies. And then there are certain very important environmental and engineering controls, which my colleague will be talking about. So friends, let's move to the first one, the early recognition of patients with suspected COVID-19 infection. And this is extremely critical that when a person arrives at a health facility, there is a triage system. So, triage is like differentiating and categorizing the person into whether that person is at risk or is not in risk or is not carrying the infection or is carrying the infection. It will allow us for early recognition of possible infection, and then we can immediately isolate that person with suspected disease in an area which is separate from others. So this will help us in making sure that the infection doesn't pass on from one patient to another and also from a patient to a health service provider. Now, there are certain very simple things to be followed. One is the distance. At the health facility, at the arrival area where there is a triage, at least 1 meter distance between the staff who is undertaking screening and with the patient. This distance is important. Then, in a health facility or in a quarantine zone, waiting room chairs for patients should be 1 meter apart. So, again, talking about distance, keep the distance. And then maintain one way flow for patients and staff. So, it should not happen that you're passing through a corridor and you're coming back through the corridor, same corridor. There should be a designated flow that if a person or even a waste is being carried, or if a doctor or a nurse is entering, what is the way to enter and what is the way to go out. Then there should be extremely clear signages for symptoms and directions. So if I am an attendant coming to a hospital or if I am a patient coming to a hospital, I should have very clear signages written at the health facility, which I should be able to read and understand what are the measures I need to follow at this particular facility. And then most important, family members, they should wait outside. We understand when there's lots of anxiety when a person comes to a health facility, not only the person but the family members are also anxious. But if we are trying to overcrowd and if we overcrowd the area, it not only increases the risk to the facility staff, but it's also putting you yourself at risk also as a family member. So at the health facility, any kind of overcrowding either by the attendants or by the family members or by any person should be avoided. So this is the first most important IPC step at a health facility, triage. Find out who is having symptoms, and if that person has a possibility of COVID infection, isolate the person and treat in a separate zone so that other people do not get affected. The standard precautions, and I'm sure most of you have heard about these precautions, but just to reiterate, hand hygiene, hand washing, hand washing, hand washing. We are hearing about hand washing all over, and this is one of the most effective steps because it can reduce infections up to 30%. And it is very simple to do. Any person can do it. It is not a rocket science. It's just that you simply need to wash your hands. And I'll request my co-host Praveen to open the poll for hand hygiene for the participants here so that everyone can vote on the question.
Sure, Dr. Pratibha. So a poll will be launched right now, and you will be given 30 seconds to answer, and launching now. Yeah.
So friends, I'll request everyone to respond to this question. What is hand hygiene during COVID-19 pandemic? There are two questions and let's see what the respondents respond. Second is the respiratory hygiene. So there are certain basic etiquettes which are expected from everyone to be followed, whether it is a person arriving at the health facility or the healthcare provider or even general population, people who are part of this discussion also. These are respiratory etiquettes each and every person should follow, which I'll be taking going forward. Then personal protective equipments.
Hello,
Personal
Dr. Pratibha.
Apurva here.
Hello.
Hello.
Dr. Apurva, sorry. You have the poll reset right now on your screen.
Excellent. I'm very happy to see that 99% people have responded correctly, and that's a itself reflects we have such an enlightened audience here. And people who are still not sure, the 1%, I'm sure by the end of the presentation they will also get converted. So thank you very much, everyone. So I was talking about personal protective equipments. Basically, these are nothing but protective gears to safeguard a healthcare provider or any person who is in close contact with a person with COVID infection or at a risk of COVID infection, so that you have minimum risk to the exposure to the biological agent. And if you see the word here, PPE according to the risk. So there's a risk profiling and detailed guidelines by Ministry of Health for what kind of PPE is required to be worn by a person. It is not necessary that everyone should wear exactly same. There is a categorization. So risk assessment is critical. That is needed for adequate protection. Then the safe precautions also mean safe injection practices, sharps management, injury prevention activities. Then, as I already mentioned, at safe handling of the equipments, cleaning, disinfection measures, which my colleague will be talking about. There are lots of sources when a no, doctor or a nurse is providing care. The bed of the patient, or even the switches in the ward or the door handles, because we are coming in contact with them very often. So these can be potential source of infection. So it is important that these are adequately disinfected and clean. Then environmental cleaning measures are important, as they are very important standard precaution. Then there's lots of linen and laundry which gets generated in the hospital, and how do you process that, how you disinfect, how you store is critical so that it doesn't become a source of infection, and all the waste that gets generated. And there's a line which is written here: the basic precaution should be used for all patients at all times, and these basics are mandatory, and they will help us in preventing the spread. So so we already had the poll. So now here's the answer to the poll, and most of you have already responded. Hand hygiene, I'm sure everyone knows that it is critical to wash your hands properly following all the steps of hand hygiene. And there are certain areas which we usually tend to forget or miss during hand hygiene, like the nail beds or the sockets behind our thumbs or the interlocks of our fingers. So these are very important areas which we should always wash our hands. And if your hands are not visibly soiled, then alcohol based rub is sufficient for 20 to 30 seconds. But if you see your hands are visibly dirty or contaminated, then it has to be washed in soap and running water for 40 to 60 seconds. Second is the respiratory etiquettes and hygiene. And I'm sure everyone is following these and knows about these, but this is just to re-emphasize. If you are coughing, any person is coughing, any person is sneezing, and especially a person who is suspected of having infection, cover your mouth and nose with a handkerchief or tissue. And if you don't have a handkerchief or tissue, just use your elbow. So you can use your elbow and sneeze into your elbow, and you wash the clothes afterwards and dispose of the tissue or in a closed dustbin. And after sneezing, coughing, please wash your hands with sanitizer if it is available, or if you have soap and running water. And then most important aspect of respiratory etiquettes also includes that one should not keep spitting here and there, because it spreads by droplet infection, and this can become a very big source of infection. And in a healthcare setting, it is important that any patient with respiratory symptoms is encouraged for hand washing all the time. But it's not just every person should be encouraged for hand washing, and this has what been happening. And patients are to be provided with respiratory masks with those who are having symptoms in the facilities. And then I also talked about keeping the distance in the health facility between the patients and one patient to another, and also maintaining social distancing between doctors. And also there are enough visual aids which are reminding the visitors that when they are having respiratory symptoms or they are coughing and sneezing, how do they cover their cough. The third was personal protective equipments, and I'll briefly just uh, uh, take you through these. These are protective gears which are meant for healthcare providers who are providing services, and according to the risk profile, it is determined which one will be used. Secondly, it is also used by people who are providing care for a person who is COVID infected. So they vary from face mask. There are the PPE includes the face mask, which can be a simple surgical medical mask, which is disposable, or an N95, which is worn by staff who is directly providing care, which is sort of a respiratory protective device. Then you have eyes, nose, and mouth shield because this helps in preventing any droplet or aerosol infection. There are goggles, there are body aprons, gowns, gloves, and head cover. So all this together combine various elements of a personal protective equipment kit. And since I'm covering only the health facility part of it, at the health facility, any individual with respiratory symptoms should be wearing a medical mask. So if you are arriving in a triage area or to a health facility, triple layered mask a person should wear not only while waiting in the hospital area to get checked, but also in during the transportation. And if a person is suspected or dedicated uh, or confirmed as a case, then there are medical masks to be worn. And healthcare workers should wear a mask while providing care. And then there are certain specific N95 or equivalent mask, which when a healthcare provider is doing certain invasive procedures, or where there are procedures where there's a high chance of getting exposed to spills or to the respiratory cough or droplets and aerosols, then the special N95 is worn. Then the third strategy, sorry, another is the contact and droplet precautions. So it is very important for the caregivers as well as the family members, visitors, that they maintain all the standard precautions so that they don't come in contact with any droplet or any surface which might have come in touch with or got infected through a COVID-19 person. So these are all the standard precautions which I have already talked about. And also they are important when a person is admitted in a health facility or quarantine zone. These are followed. And for airborne precautions, they are recommended only for healthcare workers. So we are not going into details as this is beyond the scope of this current presentation. Now, in any healthcare setting where COVID-19 patient service are being treated or isolated and service is provided, it is important that there's an administrative control which talks about educating the patient's caregivers. It is not only the health staff who should have the information or the patient. It is also very important that the caregivers are adequately educated and they have all the right information so that they don't become infected. They are able to protect themselves and then also able to provide care to their loved ones. There should be adequate policies for early recognition, and we have all the policies and guidelines put in place by the Government of India Ministry of Health, and they are available on the website. Then prevention of overcrowding, I already talked about. It is very important that the hospital management takes measures so that there is a proper triage, proper system flow. There's no overcrowding in the health facility. There's a dedicated waiting space for symptomatic patient. Then healthcare provider to patient ratio is adequate. And this is also important that also they are healthy, they maintain their immunity levels. The staff should be adequately trained, and government is undertaking lots of training, and there are intensive training programs being run across the country to ensure that the healthcare staff is trained. And also there's enough supply of all the personal protective equipments. So I'll stop here, and now I'll hand over to Dr. Pratibha, who's my colleague, who'll talk about the fifth strategy about what are the environmental control measures and what are the infection prevention and control measures at schools, quarantine facilities, and homes. And then at the end of presentation, we'll take up a couple of questions. So over to you, Pratibha.
Thank you, Dr. Purva, and hello, everyone. First of all, thanks to everyone for taking out time to join our session. So now I'll talk a little bit about environmental and engineering control. Although the words sound a little complicated, it's very easy. It's about ensuring what Apurva had said before the start of the presentation, that we have to ensure healthcare facilities remain a site of treatment and do not end up becoming the site for transmission of infections. So environmental controls are all about ensuring that healthcare facility is not spreading the infections in the environment. There is a ventilation in all areas of the healthcare facility, because we all know that there is a big role of the respiratory spread of the COVID-19 virus, and has to be handled separately, has to be washed separately. The food, service, utensils, and the equipments which are in cleanliness procedures. If upkeep of the water and sanitation infrastructure, which means the drinking water points and also the toilets, they should remain in a clean condition and a very sanitized condition, and they should be remain infection free. So it means that there has to be a very specific cleaning protocol which has to be followed more stringently in a healthcare facility when it is starting to test and admit the COVID-19 patients. So this is all on environmental and engineering control, and we will also be sharing with you later on a list of references. So like participants who are more interested in knowing about this aspect can go through that kind of content. Can I have the next slide, Dr. Purva? Yeah. So now I look at the aspect of how do we prevent infection of COVID-19 in household and communities. And in the earlier sessions, you might have been exposed little bit to this kind of information, but I would like to go a bit more specifically into this thing, and also go into the details of quarantine later on. So what do we do in households and communities? Just to add on to what you have been listening in the national TV channels and the radio channels and social media. So hand hygiene is very critical. Something which is very important to ensure is that at many times people presume, like in urban areas, that every household has access to a hand wash basin or some kind of a facility, but that may not be there in many rural areas in the communities for whom we work for. So that functional hand washing facility has to be ensured, and some of the usual times of hand washing have to be like it has to be emphasized further, it has to be enforced more strictly, is about before preparation of food, before the family has food, and after using the toilet each time, and disposing the child's diaper. And then another very important thing to ensure during COVID-19 is that we have to ensure that after any contact with a contaminated surface or a community area, for example, if you are going out for your daily groceries, even when there is a lockdown period, people end up touching the doorknob of the house, or maybe the door handle of the grocery shop or wherever they are going, and even the vehicle that they might be using, a two-wheeler, four-wheeler. So those surfaces, and again, if we like if people reside in a apartment area where there is a lift, functional lift is there, then the lift buttons and all can be all community areas which are accessed by everyone, and there are chances that person who is a carrier of COVID-19 or who is infected with COVID-19 might be transferring some of the viruses to um, the surfaces as well. So hand washing has to be more prompt, and there are several times of hand washing in each day. Then safe treatment and handling of excreta is very important. Right now I would say that there is very limited evidence which is coming out globally, but it still says that there is has to be precaution maintained in the safe disposal of excreta, and it's very important to ensure that the household toilet remains functional, and it should be clean at all the time. And for a community toilet, for people who don't have access to a household toilet, they should be able to use it properly. It should be in a clean condition, and it should be well maintained, and there should be ventilation and lighting as well so that people can use it. Next slide, please. So now I come to the quarantine facility. Quarantine is an area where there is a separation and restriction of movement. of people who haven't been ill, but who are suspected to be exposed to infection. So you might have just heard, and also during earlier sessions, you might be aware about the chain of transmission. So one person who is affected with the virus COVID-19 can actually end up infecting thousands of people. And most critical aspect to prevent COVID-19 is to break the chain. That's why we have been under the lockdown period. And quarantine is one thing which is emerging each and every day. One is hearing of increasing number of cases, and at the same time there is also like greater frequency. We might expect greater number of public buildings and community centers and all to be getting converted into quarantine centers. So the purpose of a quarantine center is to break the chain of transmission of the infectious disease. So generally people have to be quarantined at their homes, but they can also be quarantined at a community-based facility based on the fact that some of the households may not be equipped, may not be spacious enough for having a quarantine facility inside. And quarantine can be applied to one individual or a group of individuals. So there can be one site which is having quite a lot of community people. Next slide, please. Yeah. So now there's a question poll. Yeah, which Praveen can help us with. Hello?
Launching the poll.
Yeah. So while we are launching the poll, there are two words, cleaning and disinfection. So we need to know from all of you, are cleaning and disinfection the same thing?
You're closing the poll.
Yeah.
And results are on your screen. Yes.
Thanks, Praveen. Very happy to note that 82% of people are aware that cleaning and disinfecting are not the same. And regarding, I'm very sure regarding the remaining people will come to know about the slight difference which is there in disinfection and cleaning by the end of our presentation. So can I request for the next slide, please? Yeah. So coming to infection prevention during a home quarantine, like in the subsequent slides, you will hear more of the words cleaning and disinfecting. So that was the reason that we had a question just before I am taking up these slides, and I hope I'll be able to clarify that. So we ensure that only.
Pratibha, I think we lost you in between. Can you start from the slide again?
Hello.
Hello. Yeah. Yes. Sorry, we lost you in between. Can you start from the slide?
Yeah. So this slide onwards, we'll be covering about the quarantine, the different categories. So the first kind is the home quarantine, where like a person in the family is suspected that he or she might be having the COVID-19, because the series of tests for COVID-19, like it takes time, and also the confirmation of exact like a person having the infection, that also is time taking. And at the same time, if a person is suspected to having come in contact with the infected people, then it's very important to ensure the quarantine facility. I have not covered the first slide. Can I go back to the first slide, please? Yeah. So in the home quarantine, very briefly, what are the precautions to be taken? Some of the minimum things to be ensured is that very few family members should be allowed as care providers for a quarantine person, and care providers should have they have to always maintain a distance of minimum 1 meter, or ideal they know there should not be, and at the same time hand washing after every contact with the quarantine has to
Hello,
be
hello,
ensured that
Dr. Pratibha, may I interrupt?
so that's to cut down the chain of infection. The caregiver should have the mask as per the specifications, the N95 mask, or if that is not possible, the 3-layered
Hello, Dr. Pratibha.
homemade. Yeah.
Uh,
Hello.
Dr. Pratibha, can you hear me?
Yes. Yes. Praveen.
uh, uh,
Hello.
Praveen, I have a suggestion. I see that most of the participants are using their videos. If they can stop their videos, I think we'll have a better reception. So if you can request people to stop their videos
Sure,
Hello.
and
doc.
just connect through audio.
Sure, doc.
Hello.
Hello, Dr. Pratibha. Actually, your audio is not clear for us. We couldn't hear the last slide you were explaining.
Hello. Yeah, I'm
Hello.
not able to understand when the voice is breaking and when the voice is clear. Is
Yeah.
breaking when the audio is breaking, because now I'm reading. Yeah, I'm there. Yeah.
So
Oh,
Pratibha, we are requesting participants to switch off their videos because I think that is creating the issue because the number has gone up and so I'll request everyone, please switch off your videos and if we can be connected through audio.
that would be great. Thank you, Dr. Apurva. Requesting all participants to kindly close your videos.
Hello. Yeah. Hello.
Yes, Dr. Pratibha, you may continue. Thank you.
Yeah. I'm back. Yeah. So, just looking at some of the precautions that have to be taken during home quarantine. This is a slide from where I think the voice signal started dwindling off. So, some very basic things have to be ensured that there should be very few family members who should come in contact and who should be the caretakers for the quarantine person, and they should be like they should not be allowed to maintain the contact for a long period of time, and at all times a distance of minimum 1 meter has to be maintained from the quarantine person, and the caregiver must have a 3-layered mask on while they are near the infected like with the quarantine person, and quarantine person should be using a separate toilet than rest of the family members, and if this is not possible in some of the households, then the toilet must be cleaned and disinfected after the quarantine person has used it. So here I would like to just briefly talk about the difference between cleaning and disinfection. Cleaning is simply about removing the physical traces of dirt, like it's about mopping and it's about the dry cleaning or vacuum. So this is all physical cleaning. It removes the physical impurities. Disinfection, as the word itself, if you decode the word disinfection, it means that one has to remove the traces of any pathogens which can lead to infection, which includes viruses, bacteria, and other kinds of pathogenic life forms which can lead to diseases. So disinfection is generally done with a certified disinfectant. So there are many brands available in the market, and these can be used, or the disinfection of disinfection of the wounds which are there, or with the disinfection of the body. So even those kind of disinfectants are there. So the commonly used disinfectants for the household use have to be generally mixed with water and used, and in case it is not available, then a chlorine solution of very dilute concentration can be used for cleaning. Next slide, please. Hello. Yeah. So the high touch surfaces of the house, like the counters, tabletops, and doorknobs, and telephone, keyboard, and the bedside table for the quarantine patient, they have to be cleaned, disinfected every day, cleaned and disinfected. And the household items which the family uses should not be shared with the quarantine person, and the linen that the person is using has to be washed with warm water and soap and disinfected and sun dried. So very critical for saving the life of family also and the nearby community. Next slide, please. Can I have the next slide?
Yes, Pratibha, it is there.
Yeah. So for, like as I said earlier, that if a disinfectant, a commercially available disinfectant may be difficult to get, then a chlorine solution, sodium hypochlorite solution of 0.5% chlorine can be used for 30 minutes, and after
Hello, Dr. Pratibha.
linen has to be rinsed with clean water and it has to be dried in sunlight. So takes care of a lot of pathogens also. So then it removes a lot of. I can hear you. Hello.
Hello, Dr. Pratibha.
Hello.
Hello, can
Yeah.
you hear
Can I
me?
continue? Because I can hear you, but I am not sure when there's a
Actually,
problem.
last 1 minute, 1.5 minutes, we couldn't hear
No,
you
I
properly.
no. Actually,
Uh,
when I got interrupted, then I was not speaking. I thought maybe there is some problem. I'm
it's
really
okay.
not sure. It's very difficult.
It's okay. Please continue. Yeah,
Yeah,
please.
yeah.
Sarabjit here.
So
I suggest that you check at your end if there are other devices which are using the bandwidth. उनको भी बंद कर
no, no,
दीजिए.
I don't have.
हाँ ठीक है. टेक्नोलॉजी इज वेरी गुड, पर वो फेल तो होती ही है, अक्सर होती है.
Yeah,
तो इसमें
you're
इसमें
right. Yeah,
घबराने की कोई बात
yeah,
नहीं. आप प्लीज कंटिन्यू करिए.
yeah. So the last point, the critical point is that the quarantine person has to be placed in a single and well ventilated room. And one of the most critical part is to have a close coordination with the healthcare providers and ASHA workers during the time of home quarantine. Next slide, please. Yeah. So now I come to the infection prevention steps which have to be followed when school or gram panchayat or community buildings have to be converted into quarantine centers, because there are some there have been some directives from the Ministry of Human Resource Development also, and from the Ministry of Panchayat Raj and Rural Development about this kind of circumstances where a lot of mass of people have to be quarantined, and there is no adequate space and householders are not equipped with the proper knowledge, and they don't have the facility for having a proper quarantine center at the household. So for a community quarantine centers, a proper assessment has to be done, and it has to be ensured that uh, the the facility which has to be used as a quarantine centers, there is a capacity to hold that many people. So that means every bed of the people who get quarantined should have a space of minimum 1 to 2 meters, and there has to be proper access to delivery of food, medical facilities and other supplies. The lighting, power supply, ventilation, heating, electricity and all have to be ensured at that kind of quarantine center. And if the quarantine center should ensure that at least for every 5 bed there should be one toilet minimum. So there should be a very strict security arrangement as well, and because there are many cases happening where people are like feeling very confined in the quarantine centers, the people who are suspected with COVID-19 with lot of myths, and sometimes also under influence of rumors also people tend to run away from the quarantine centers, and like there is a natural tendency for family members and community affected COVID-19 person who is quarantined to visit them. So strict security arrangement has to be maintained, and quarantine word itself means that person has to be separated from the community, separated from the family to break down the chain of infection. So that means movement restriction has to be very strictly ensured, and at the same time there has to be very the access of the community center or access to a particular like a tertiary healthcare facility has to be ensured. So this means that the particular community hall, the panchayat center and the school has to be on the like on it has to be at an accessible location. It should not be so remote that it cannot be it's difficult to reach by road. And at the same time we have to ensure that the human resource arrangements are in place. So there has to be like the trained sanitation staff have to be there, and even the healthcare professionals who are going to be placed in the quarantine centers, like they should be available at the times when they are needed. So now I move to the next slide, please. Yeah. So water availability and that also safe drinking water should be available for people, and also sufficient water should be there for laundry services, and there should be the HR arrangements also in place who can take care of the laundry services and providing drinking water. At the same time, the telephone connection at that particular center, which has to be converted into quarantine, should be functional at all the time. Then sanitation services and housekeeping have to be ensured by trained people. And at the same time, biomedical waste disposal has to be ensured with the use of properly covered bins as per the guidelines. Next slide, please. So now coming to the stage where we hope to soon get rid of the COVID-19 linked lockdown period, and then the normal time when the schools, the gram panchayat and community buildings that were converted into quarantine centers have to be rehabilitated and have to be used for their normal functioning. So before we start the normal activities in the buildings that were once used for quarantine, certain minimum standards have to be, certain standard operating procedures have to be followed, and a proper disinfection has to be ensured. So the guidelines are already in place for this purpose, and they were recently issued by the National Center for Disease Control. And it's very important that one realizes the fact that normal cleaning with water and household detergents and the commonly available disinfectants in the market, it is sufficient for the general precautionary cleaning. And at the same time, the sodium hypochlorite solution of the required dilution is required to be used, like for the medical equipment cleaning and cleaning of all the, especially disinfecting the laundry used by the person, and also for the cleaning and disinfecting of the furniture and other things which have been used as a which have come in contact with the patient and the care providers of the patient in the quarantine facility. Next slide, please. Yeah, so with this I come to end of the presentation, and we would look ahead to the questions, whatever can be taken up.
Thank you, Dr. Apurva and Dr. Pratibha, for the wonderful presentation. Now we will be taking questions from the participants who are raising hands, as well as from the chat box. We have selected a few questions which can be answered. So starting with K. Anuradha. K. Anuradha, I'm going to unmute now. You can speak. Thank you.
Dr. Pratibha, I just wanted to ask that can you give us some 10 to, or maybe Spear India, whoever, can you give us some 10 to 15 checklists that needs to be seen, whether they exist or don't exist in the community transmission centers? Are they available anywhere? What are the 10 or 15 things? Yes.
Definitely, yeah, Mr. Anuradha, these checklists are available, and these I would like this is one commendable job which was done by the ministry at the ministry level, and UNICEF was contributing to that along with WHO and some other partners. So these checklists, in fact, they are in place ever since we started with this problem, ever since the COVID-19 led emergency kind of situation started in the country. So there are checklists which help you quickly make an assessment whether a community facility can be used as a quarantine center, and what are the minimum things you have to take care of, and we will definitely share with you.
Okay, thank you.
Yeah.
Thank you, Anuradha. Thank you, Dr. Pratibha. Next, we have Diksha Gupta. Diksha Gupta, I'm going to unmute now.
Ma'am, my question is for animals which in our home. So, what are the precautions for them also?
So, in case like you have an animal who you feel is not sick, and they might be displaying some coughing and sneezing kind of thing, so maybe you can consult a veterinary doctor, and since there is a lockdown period, maybe a telephonic consultation can be arranged, because that's very critical. And I would say, unless the the pet is not displaying any chances of any infection and they are just normal, so then I think that won't be a problem. But I think if Dr. Apurva may like to add further to the response, she can contribute.
Yeah,
Okay.
yeah. So Diksha, just to add to it, as of today, there are lots of studies which are talking about some apprehensions about animal transmitting your pets, but there's a clear advisory from the ministry that your pet animals are not source of infection and you should follow the same precautions at home while you're like the general hygiene measures, and especially try to restrict their movement outside, that taking them for a walk is enough but not intermingling too much into the areas which everyone is already doing. And I was also watching some infection control measures where they say that when you're bringing your pet inside the house, it would be good that like you are disinfecting yourself and washing hands. If their feet can also be cleaned before you bring them back into the house and maintain due precautions, that's most important. And also what Pratibha mentioned, if you think your pet is falling sick, then please consult a doctor.
Okay,
Thank
ma'am.
you.
Thank you so much.
Thank you.
And
Next,
Praveen, one second, if I may just come in here, this is Valerie. We are also
Yes, ma'am.
having like a special module on this, also for care for animals during COVID-19 and aspects related to COVID-19 and animals. We're having a special course on that, I think next week. It will be updated on our website. So if you need more information, it'll be provided by the faculty over there as well. Thank you.
I
Praveen,
think
you may.
that I think that would be really great. I think it will be a very important topic for everyone. Thank you, Valerie, for adding to.
Praveen, you may
Thank
continue.
you. Yeah, thank you, Valerie. Next we have Amlan Senapati. Amlan, I'm going to unmute now. You may speak.
Good afternoon to everyone. Good afternoon to everyone. My question is that we are going to the vegetable market to buy vegetable. If an infected person touch the vegetable, if I touch that vegetable, can I be infected? Hello.
Yeah, hello. So you have to follow the same precaution like when you definitely if the infected person is touching the vegetable, the virus can survive on the surfaces for a particular duration of time, but it is very much dependent on temperature and other things. So it is very advisable to follow the same precautions that best possible try to wear gloves to the vegetable market, and there are very low cost ones, the single use washable ones as well. And once you get the vegetables from market, they have to be put in a solution, in a salt solution for at least 5 minutes, so that it takes care of the virus, gets disintegrated in a salt solution, and then you can wash it with water and use it for consuming in the house. So I would say that all the surfaces, not just vegetables or anything, are very much susceptible to retain the COVID-19 virus for some time unless and until they are washed and cleaned and disinfected.
Yes, ma'am. In the case of newspaper, what should we do?
Yeah, with newspapers also, like the advisory that has come from the government is like about putting them in the sunlight for at least 10-15 minutes in a like a proper sunlight, I would say, not in a cloudy weather or something. That takes care and disinfects, but that's a very tough thing, and you have to like keep turning around, shuffling the pages also. So a lot of advisories are also coming that maybe newspaper circulation can be very much restricted or minimized during this time, because when newspaper collection and printing time, there's a lot of contact with hand.
Thank you, ma'am.
Thank you. Next, we have Mr. Ganesh. Ganesh, I'm going to unmute you. You may speak now.
हेलो प्रतिभा मैडम,
Yes.
वेस्ट मैनेजमेंट में अभी जो मास्क लोग यूज कर रहे हैं, वो
Yes,
हम
yes.
देख रहे हैं कि अभी रोड पे भी वो मास्क दिखाई दे रहे हैं. यदि उस मास्क का जो वेस्ट मैनेजमेंट है उसके लिए
हाँ,
आप
हाँ.
क्या करोगे, किस तरह से? क्योंकि पॉजिटिव पेशेंट का भी वो मास्क यदि बाहर आता है तो उससे भी रिस्क बढ़ सकता है, और
Yes,
इन
yes. You are
और
very right. Yeah.
बहुत इम्पोर्टेंट है वो. तो
Yeah.
उसके लिए मैडम आप थोड़ा गाइड कीजिए.
Ganesh, I will try to respond briefly to it, because my health colleague, health specialist is also here. So पहले तो आप ये समझ लीजिए कि मास्क which has been used, जो मास्क यूज किया गया है इन्फेक्टेड व्यक्ति के द्वारा, वो अपने
हाँ.
आप में इन्फेक्शन का एक स्रोत है ना. इट इज अ मोड ऑफ ट्रांसमिशन ऑफ इन्फेक्शन. सो उसको उसी प्रकार से ट्रीट करना है जैसा कि बायोमेडिकल वेस्ट को हम ट्रीट करते हैं, जैसा अस्पताल से निकलने वाला जो वेस्ट है उसको। तो यदि ऐसी कोई आपके पास सुविधा नहीं है, पहला तो ये है कि आप उसको अलग से सेपरेटली यू कैन डिस्पोज इट ऑफ लाइक अ बायोमेडिकल वेस्ट। उस प्रकार की सुविधा न होने पर उसका आप एक पिट में उसको डाल के, एक गड्ढे में डाल करके उसको जला सकते हैं। इस प्रकार के यदि आपके पास मास्क निकल के आ रहे हैं तो। और
Okay.
मैं अपने कलीग अपूर्वा जी से बोलूंगी अगर वो इस पे और बताना चाहें थोड़ा।
Okay.
I think Pratibha, you've covered it very well कि अगर कोई भी mask है, especially if a person who is suspected of infection या फिर infected है, तो वो equally potential source of infection है और उसको एक biohazard waste जैसे ही हमें treat करना होगा। And best is that if it can be disposed of properly following those measures, अगर वो नहीं है तो प्रतिभा ने जैसे कहा कि उसको disinfect करके फिर उसको dispose करें।
Okay. Thank you, madam.
Thank you. And now we have also many questions in the chat box. Can I refer to 3-4 questions
Yeah,
there?
sure. Yeah.
Yeah, sure. So one interesting question was, what are the suggestions for frontline workers with pre-existing diseases like diabetes, hypertension, etc.?
So let me take this question. See, frontline workers, when we say frontline workers, we are literally talking about our ANMs, ASHAs, and Anganwadi workers mostly, and all the people who are working at the community level for screening. And any person who is having a diabetes or any comorbidities, it is definitely a person who will have a little higher risk than other people for getting not getting COVID infection, but if catches a COVID infection, will have more chances of severity of disease. So, agar basic precaution is followed by that person to prevent himself or herself from catching the infection, that is the most important thing. That you should take all the precautions when you are in field to have your mask, your gloves, aprons, whatever PP is according to your profile, which is recommended. Have those and then venture into field. Maintain your immunity, which is extremely important through a proper diet, through exercises, if you do certain kind of exercises and other measures. So maintain your immunity, which is important. Third is social distancing. So whenever you're providing services, be it at the VHNDs with the or at the house to house level, maintain proper social distance. So protecting yourself is more important. And if you can protect yourself and make sure that you don't catch infection, then you are, I'm sure, in a quite safe zone. And then if you are having any comorbidities, please continue with your treatment, whatever has been advised by to you for by the doctor, be it for hypertension and diabetes or whatever you're suffering from, and be in touch with your doctor through telephone or anything if you feel if your symptoms are worsening. And if there's any problem, immediately seek medical care. Please do not ignore any of the symptoms. So those are the advices I think I will give to an FLW.
Thank you, Dr.
If
Apurva.
I can just add
Yeah,
briefly here,
sure.
actually for frontline workers like Dr. Apurva is saying, there is a very useful guidance document. It is known as Handbook of 5. It is meant for ASHAs, Anganwadi worker, and also the ANMs. And it also applies to other frontline workers. It has been developed by the Ministry of Health and Family Welfare. It is very much available on the website, and it is available in almost, I would say, till the best of my awareness, there are 6 other language version also. It's in English, Hindi, and some other languages as well.
Thank you, Doctor. And we have another question from the chat box, which says, is 1 meter distance sufficient? Based on some new studies, the virus can be found within 3 meter from the infected person.
Dr. Apurva, would you like to respond to that?
Yeah, so the current recommendation is maintaining at least 1 meter distance. And that is the recommendation coming from the WHO guidelines, which are being followed, and also the ministry guidelines tell us that we should maintain at least 1 meter distance.
Actually, there are some documents maybe which are confusing. I have seen a lot of other comments in the chat box. Recent studies are saying that there can be a spread of the virus till 12 feet. But I would say that COVID-19 virus is like the research is evolving more and more because it is very new for the entire global scientific fraternity as well. So new research is coming. So that is why we keep saying 1 to 2 meters. So that is the best possible. Yeah.
Thanks, Pratibha, for bringing that up, because that's very important that this virus is new for all of us and we are learning every day. And what may be the guideline today might change tomorrow as the scenario changes or the situation evolves. So that's the scenario. Over.
Thank you. Thank you so much. And we have one more question to take. We can take one more question from the chat box. It says, how far the BCG vaccine retard infection, or most of our children were vaccinated?
I think Dr. Apurva can respond to that. That's a very health specific question.
So let me come back to this question, and I think there's lots of discussion around BCG vaccine happening and lots of studies going on. But the current recommendation by WHO is that the routine vaccination should continue for children as the way it has been continuing. The birth dose vaccination should be given to all the children who are who are being delivered at the health facility. And let me read this out from the you know a document from WHO which says there is no evidence that the BCG vaccination protects people against infection with COVID-19 virus. Two clinical trials addressing this question are underway, and WHO will evaluate the evidence when it is available. In the absence of evidence, WHO does not recommend BCG vaccination for the prevention of COVID-19. WHO continues to recommend neonatal BCG vaccination in countries or settings with a high incidence of tuberculosis. So I think this statement from WHO makes it very clear that we should continue the vaccination for the newborns who are getting delivered. But as such, for COVID-19 prevention, it is not recommended at the moment. Thank you. Over.
Thank you, Dr. Apurva. May I know how many more questions can we take from the participants?
How much time do we have? We can take few more, I think.
Praveen, if we can look at the chat box, there are quite a few very good questions there. So Pratibha and Apurva can select which one they want to answer.
Okay, sir. Sure. So, I think you can see the chat box. You can also select questions. I will also help you refer some questions from the chat box.
There is one question which is there about what about making train coaches as quarantine centers, which was I think 2-3 places that question is there. So definitely that's happening in a big way, that in many places in the country train coaches are getting converted to quarantine centers. But since we are all aware that the train coaches and the entire railway properties can be accessed by the staff who are working for the railways, and I was aware, we were all aware about the the description of the people, the participants, and what will be their avenue of work, the areas of work. So that is the reason why we did not cover train coaches in our presentation. And then there is one question on the number of toilets available for specific number of person in quarantine camp and center. So somebody said that why only 5 toilets per bed. So I would like to respond to that and the additional questions which are linked to that. So the reason is why we are taking 5 toilets minimum for one bed. Actually, ideal is one toilet for one patient. But since that may not be possible in many circumstances, because we have to be aware of ground realities in many parts of the country. So that is why the minimum standards which are prescribed by the government of India and the guidelines, that is the reason why there are 5 toilets per bed.
Pratibha, can I take two
Yeah,
questions?
sure.
So I saw a question which is someone is asking that what is the source of COVID-19 infection and what are the sources of information to gain more information. So we all know that COVID-19 infection is caused by a coronavirus, which is called SARS-CoV-2 virus, which is a RNA virus. And it is a viral infection which currently is now transmitting from human to human. And we know more than 185 countries are already affected. And in terms of source of information, the Ministry of Health and Family Welfare website has a repository of all the guidelines, all the resources, and I would encourage everyone to please go to the MOHFW website for any order, any circular which the ministry has released, and also for information you can refer to WHO and UNICEF sites. So those are the ones. Then another question is someone is asking about mental health. Yeah, this is something very important, and as you can see, we as a country, we have been in a state of lockdown for almost 3 and entering into the 4th week now, and there are lots of mental health issues we keep hearing about and we get to know. And also for the people who are working in high pressure circumstances, like our health service providers, our frontline functionaries, the people who are doing surveillance, the administrator, the caregivers, the police people, so they are continuously working under stressed environment and high risk environment, and they are bound to be mental health issues which are coming up. So there are various counseling services which the government has set up with prestigious institutes like NIMHANS. And if you go on the MHFW website, there are contact details of how you can avail those services which are free of cost. And it is important that people maintain their uh, when they are staying inside your houses, spend time with your family members, talk to your family members, do some meditation, spend some time in yoga, engage into any hobby which you have been trying to uh, think of finding time to do. And also, most important, refer to the authentic sources of information. There's too much misinformation circulating on social media which can lead to panic, which can lead to lots of misinformation, and that affects you mentally. And we don't realize, but we all have become addicted to checking our mobile phone so often, and especially WhatsApp. And if you see WhatsApp, there's tons and tons of information which can become a source of mental stress. So spend more time with yourself, your family members, and there are resources available, counseling services available. Please avail those. So that was on the mental health question, and I'm glad that someone brought this up.
Thank you.
Can I respond to one question which people have been repeatedly asking about? Is excreta a source of spread of infection of coronavirus? So just to respond to that, like as Dr. Purva said, it's a very new problem for the entire humanity, the coronavirus, and we are learning each day. And there is no, I would say, history or like a history of research behind this virus. So only some of the nearly similar viruses have been studied, and definitely some of the traces of a family of virus which is related to the coronavirus was found in the sewer systems. But then again, that was only in 1 or 2 countries, and it's not happening across. So and in those countries it was found that the sanitary workers, the staff who are taking care of the sanitary waste, like who are engaged in the sewer management and wastewater management, they never got the chance of getting affected. So it's not that it's like very widely happening, that feces are like a source of transmission of coronavirus. However, having said that, at the same time we have to remain very much cautious and very much aware of the fact that like complete research on coronavirus has not been done, and the virus is also capable of mutation very fast. So mutation means it can change itself, so it can definitely also persist in feces. And somebody asked the question about if the virus can survive in a highly acidic environment of the stomach of human intestine, the like a very alkaline environment of the intestines and all. So just to respond to that question, the physiology, the structure of the virus is that the outer covering is very much labile, or it's very prone to getting attacked by a very much acidic environment or a highly basic environment. That's why we keep on telling you about disinfectant, and also using salt water if something is very difficult to obtain, or there are particular things which cannot be disinfected with chlorine, then we can use even salted water for that, and even high temperature, so that can break the outer wall or outer covering of the virus, and the virus can dissociate, and it can be rendered ineffective. So that's all. Thanks.
Praveen, do we have time to take a few more questions, or we are?
Yes, ma'am. Yes, doctor. We have time for. We can also look at the participants who have raised their hands if you want to. So
Dr. Apurva, if I can come in just here once, I received a private message on the chat about a question on dead body management. What is the risk level of handling dead body? Is there a possible transmission from the dead body? So this question has been asked a lot, and I was wondering if you can address that.
So for responding to this particular question, I'll suggest that there's a detailed guideline on Ministry of Health and Family Welfare on dead body management, which talks about the use of body suits and what precautions are to be taken while handling a dead body. And definitely there are chances of infection, because if a person has been infected and there are body fluids which are still there and virus is surviving. So for that, I will request the person who has asked the question on MOHFW website. There's a detailed guidelines on this particular aspect, and you can refer to those.
Yeah, also people are like we are getting advisories from the government that not more than
20, I think
20
20
people can
people. Yeah.
assemble at the cremation funeral ceremony, and that also with social distancing. And again, there has to be precaution observed by the people who manage the crematorium as well.
okay, thank you. So I'm going to unmute some people. Okay, since we have time, we can go to the participants who have raised their hands as well. So going to Diksha Gupta. Diksha Gupta, I'm going to unmute you. You can ask your question. Diksha Gupta. Okay, moving on. Pushpalata. Pushpalata, yeah, thank you, please.
सर मेरा क्वेश्चन ये है कि जैसे इतना सब कुछ हो रहा है, गवर्नमेंट कर रही है, लेकिन कितने लोगों में अवेयरनेस नहीं है, उनके कारण बहुत सारी गलतियां हो रही है जो इतने लोगों को इफेक्ट हो रहा है। तो इसके लिए कुछ सॉल्यूशन अपन कर सकेंगे क्या, ऐसा कुछ टीम बना के या कुछ इस टाइप का? हेलो
हेलो।
उससे फिर कैसे कम्युनिटी में भी फियर रहता है, फैमिली में भी, जैसे कुछ पता चल गया।
Is it Diksha asking this question?
No, it's hello.
Yes, basically I am a teacher,
yeah.
high school teacher. Yes.
Yeah. Yes,
so
please.
I would say आपसे बेहतर कोई नहीं हो सकता, and people who are connected to this group Sphere India and people who are really working at the community and directly working, each and everyone can be a messenger. It is not just government we should be thinking about. हम सबका role है. Everyone has a role. You talk to your family members, you talk to your neighbors, talk to people. In fact, there was a if a person can just pick up a phone call and talk to 10 people who he or she knows and request that person to talk to another and spread the right words, that's how community awareness.
Yes, madam. This I am doing with my WhatsApp group or the students of my class.
So बस वही करने की जरूरत है. Everyone becomes the ambassador and everyone comes together to spread the correct messages. The most important thing is correct messages and right messages. And if you're not sure of certain thing, just consult an expert, find the right answer, but just don't. There's no harm in saying I don't know. आप लोग भी कोई question पूछेंगे, and if I don't know, I can always say I don't know. I will come back after knowing. क्योंकि ये नया virus है. We all are learning. So
yes.
that would be my response. Everyone should participate and contribute.
Yes, madam. My one question. कि जैसे हम लोग घर में काम करते हैं, ये करते हैं, तो उस समय भी हमें केयर लेनी चाहिए क्या कि कवर करना है माउथ को, ये करना है?
See, care and precaution everyone has to take all the time, but then if you are in a lockdown zone, if you are not moving out of your house, you have not been in contact with a person, there's no movement, then basic precaution, hand washing, distance will be maintained करिए, ये जरूरी है. Because you never know, you are getting groceries from outside. बाहर से सब्जियां ला रहे हैं, दूध ला रहे हैं, उनको क्लीन करना, जैसे प्रतिभा ने बताया, या वेजिटेबल्स को क्लीन करना.
This we are doing, but only the doubt is about the covering of the.
There is no harm in overdoing. हम ज्यादा भी कर लेंगे तो उससे नुकसान नहीं होगा. But if we underdo, we are at risk. So overdo करना में कभी नुकसान नहीं है. As long as we are not putting extra strain on the resources.
Yes.
Thank you, Pushpalata. Moving on to Dr. Rajni Srivastava. Rajni Srivastava, I'm going to unmute you. Thank you. Dr. Rajni Srivastava, you can unmute yourself. You have mute. Okay, let's move forward. Mr. Mohit Lakra, you may speak now.
Uh, Actually, for this awareness, I have one thought that see, patrolling by policemen is at every society, every community level. They are everywhere. So best way to spread awareness is by speakers, because this policeman can announce while patrolling on the streets and all. That will be a best way. And this thing can be done in slums also, where awareness is very low. So is this a big suggestion?
I think it's a very good suggestion, and I'm sure it must be happening, or that's a very valid suggestion, good one. And if
Okay.
through your resources and channel, you
Okay.
can take it forward.
Thank you, Mohit.
Can I
Because
respond to one
Yeah,
question?
Pratibha.
Yeah, which has been displaying in the chat box. Many people are asking about medicines, like which medicine to use. Some people are asking about hydroxychloroquine and some other medicine. So I would say that first of all, don't take anything without consulting your doctor. And either there are many alternative streams of medicine also, like I'm talking about the branded medicine which are available. So even with the alternative medicines and the hydroxychloroquine or anything else, the proper medical assistance or advice has to be taken before taking any such medicine. Even if people in the community are saying that have this particular medicine, it's going to prevent against the disease and all that.
Thanks, Pratibha. And just to add to it, because I'm also seeing lots of question around hydroxychloroquine, and it has been a buzzword for few weeks now.
Yeah, yeah.
So, but again, there are only special circumstances and special guidelines in place only to be prescribed by a medical professional and doctor. The general community people are not required to uh, self-medicate even paracetamol or anything. If you feel there's any symptom or anything, just consult a doctor. Over.
Thank you, Dr. Apurva. Can we take more questions?
Yeah, I think we have 10 more minutes.
Okay, sure. So we can always look at the chat box while I'm going to the participants. Dr. Kushant, I'm going to unmute you. You may ask your question. Dr. Kushant, please. Okay, Dr. Kushant has muted himself.
So
Let's
There
move
is a
forward.
question, Dr. Apurva, which has been put in the chat box more than 2 times, and even Sarabjit ji has forwarded it again, that somebody's father is a doctor and sister is a health worker, and when they come to home, what should be the minimum distance
so
people have to maintain?
I think it's a very important question, and thanks for bringing this up, Sarabjit ji, because if you have a person who's a healthcare provider working in a hospital setting, and considering that now we are starting to get the symptomatic and asymptomatic both kind of cases in the hospitals, it is important that when this person returns to the house, social distancing is maintained. And I know it is psychologically, emotionally very tough for family members to maintain those kind of distances within the house, but it is advisable that the person or healthcare worker keeps a check on his or her own symptoms, follows all the precautions of hand washing, of correct ppe, of respiratory hygiene. Try not to use the same utensils and same, you can separate your towels, you can separate your dishes. If you can do that, wear a mask at the home also if you feel that you are exposed to patients who are symptomatic, and maintain a distance. It will be tough, but yes, it is important. Over.
Thank you. Another question which has been popping up was what kind of precautions need to be taken care in case of a community kitchen? In case your hand.
So yeah, so community kitchen, like precaution in terms of the raw food stuff like vegetable, and maybe if non-vegetarian item is there, so proper washing has to be taken care of, and it has to be ensured that it is the food stuff is not in a rotten condition, and it's not spoiled also for usage. And before preparation, hand washing has to be ensured, and ideally if possible gloves can be used, and also headgear can be used in the community kitchen. And in the community kitchen, after cooking of food, the serving of food has to be done with lot of precautions, and social distancing is very critical when distribution of food is being undertaken. And people who are collecting the food also, like the beneficiaries or people who actually need the services of the community kitchen, they should be wearing a mask as much as possible while collecting food also. So administrative control also is very important in community kitchen, apart from the general hygienic steps to be followed.
Pratibha, there's another question I see for you. Can coronavirus survive in grey water, especially near hand pumps? I think it would be important to address.
So in the gray water, since it's not water which is coming from the toilet, for everybody's information, it is the water which is discarded after washing of clothes, utensils, and bathing. It's not the water coming out of the toilet. So definitely we are learning, still research is ongoing on the virus, and very few studies have come which show that grey water is actually a site for breeding of COVID-19, because viruses, as we all know, are not that very good in surviving in water, and especially grey water, because it has high concentration of impurities, which has such chemicals which can disintegrate the virus. But at the same time, more research is needed on the virus, the coronavirus. So that is why government and everybody, all the authorities are advising precaution against any means of spread of coronavirus. So in while collecting water from hand pump, it's very important that you ensure that you avoid spluttering or splashing the grey water. So avoid the puddles and the grey water collection points which are nearby the water points where grey water can get stored. And the steps of disposal of grey water should be adequately ensured, and more so in the context of COVID-led emergency. Over from my side.
Okay, so I see a question which is, I see two questions pertaining to vaccines. When will vaccines come in contact? Are there vaccines? So friends, there are a lot of vaccine trials going on, and we are all waiting and for the vaccine to be in market. So far, we don't have any vaccine available, but let's hope it comes at the soonest. And as you might be knowing that for vaccine, there has to be a certain procedure and protocol to be followed before it can be declared safe for human use. So there are research in place, and I think there are more than 40 vaccine trials which are already at advanced stage. So let's hope for the best.
So,
yeah, I see a question about precautions to be followed by people who are free from COVID virus. I would advise participants to look at the presentation when it is shared with them. And we have tried to cover many aspects that what a normal person can do to remain free from the coronavirus infection. And if you look at the TV channels these days, the government advisories, the radio jingles, and other things which are coming, so I think it is all meant for normal people only. Some people who are not right now not infected by the coronavirus. So I would say that just keep on looking for more information, keep yourself informed, and uh, get the information from the authorized sources, from the government websites, from the official advisories. And before you see a message on social media which you feel that may not be coming from the right authority, then try to check whether the source of information is correct. Try to check whether whether it's just a rumor or the information is correct or not. That's all. Thanks.
I see a very interesting question. I'm not able to read it fully due to some reason, but it says standard precautions in tribal dominated blocks of India, as most of the tribal communities don't follow the social distancing. I can't read the first part of question, but let me tell you, some of the most beautiful examples of social distancing have come from the tribal blocks of India. And I would like to quote from Odisha. Odisha, there is a picture which is circulating, and we have been using it in our presentations also, where in the dense forest area in a village, the tribal community women are at a hand pump, maintaining social distancing better than what we will maintain in the urban areas or even the other people. So I think it's a misnomer that tribal communities are not following social distancing. If given proper information and if we are able to tell them what is the benefit of following social distancing and how you can protect yourself, every person will follow. So it's all about how you are able to communicate. Over.
Thank you, doctor. I think it is time for us to wrap up. Or do you want to take some
Just
more
one
questions from
last
the chat
question is
box?
there.
Yeah.
Yeah, one last question which I see many participants are like having about the currency notes, because some recent case has happened where a pizza delivery boy in Delhi ended up like he was corona positive, detected corona positive. By the time 70 families had come in contact with the pizza delivery person. So about the currency notes, again, like the government advisories are coming that whenever you exchange the currency notes, so you have to ensure that the sanitization is done. You can use a alcohol based sanitizer and maybe dry the currency notes and the coins after that in sunlight. And in case there is no access to this kind of isopropyl alcohol based sanitizer, then maybe solar disinfection. But again, you have to be very cautious about turning the currency notes, and you have to also wash your hands before you disinfect after you disinfect the currency notes and the coins. So what is coming out majorly in many government advisories is that try not to use the currency notes and coins during the phase of COVID-19, and try to use online mode as much as possible, and you may resort to this option only when there is no other option available. Thanks, that's all from my side.
Thank you. So, thank you so much, Dr. Apurva and Dr. Pratibha, for the wonderful session and the question and answering all these questions and responding to them. Thank you, participants, for your patience and attending. And we look forward for your participation in our future courses as well. So to complete the course evaluation and to receive your certificate of participation, so you can see the link, and you already have the link as text messages in your mobiles and emails. So please visit after 24 hours of the session, and we have our next session tomorrow, and I would like to call Valerie to give some details about the tomorrow session. Valerie, are you there?
Yes. So as a principal, we upload all the details about our upcoming sessions on the website. So one is that you can visit the website. Our course tomorrow is on disability inclusive COVID-19 preparedness and response. The course will start at 11 a.m. and will end by 12 to 12:30. So please feel free to register for the course through the website. Thank you.
Thank you. Thank you all.
Thank you. Thank you very much.
Thank you so much to all participants and organizers. Thanks.
Thanks. Have a good day, everybody.